How's it going, all the providers out there? My name is George. I am an MMP. I specialize in neurotherapy and neuromuscular facilitation. And I wanted to make this video specifically for you guys to give you more of an explanation on what neurotherapy is, how it benefits you, and how it benefits patients. Ultimately, this is going to be our first topic that I want to discuss with you here real quickly is what is neurotherapy. So what I've designed is I've put together sort of a combination of different things, including real medical massage therapy, which combines a lot of sports remedies, provides a lot of neuromuscular facilitation, active release, PNF, things of that nature, in combination with a device that I use, which is a neurotherapy reprogramming of the central nervous system. These two combined together provide the ultimate pain resolution. Now, I use pain resolution and not pain management because pain management seems like it focuses a lot more on how do we eliminate the symptoms that the patients are experiencing. Well, unfortunately, with that approach, what happens is along the way, the pain generally comes back because the problem is much farther or it's much different from what they're actually experiencing as a sensation. And as you know, pain is sort of the body's or the brain's way of telling the body that something is wrong and I need you to fix it. But that doesn't mean that that's where the problem lies. It just means that's where the problem has manifested its symptoms or manifested the sensations to the patient, which is very different. We want to actually get to the root of the issue, which is what neurotherapy does through diagnostic procedures that I do and a couple other ways that we fish out where the problem started. And that is the frustration that I see a lot of times in pain management where the knee hurts, let's inject it, let's do surgery on it, let's chop it off, let's burn it, let's do something to it so we can stop this pain from, continuing. Where the problem actually might be somewhere in the hip. It might be somewhere in the hip flexors, it might be somewhere in the abdomen or in the spine or something. And so while we're doing this, we're actually not only causing the symptoms to go away, but we're restoring the muscle's ability to do its job again. Let me get into that. The muscle's job has two things, very two important primary things that it does. A muscle needs to lengthen at full capacity and it needs to absorb stress. What that means is these are your body's shock absorbers, right? So without them, when we're walking, when we're jumping, when we're sitting, when we're playing, when we're doing whatever, force is being exerted. And the thing that needs to absorb that is muscles. And if muscles are supposed to do this, but all they're doing is this, every time you perform a movement, that force is going to go into other places in the body where it doesn't belong, like joints, bones, ligaments, tendons, and other things like that. The issue with that is over time, the symptom becomes arthritis, inflammation, soreness, inability to move, significantly reduced range of motion. And these are the things that patients really suffer to understand how to approach it. When we look at it as why you have pain, not where, the outcome can be much better. And that's how it's approached. So the other thing I want to talk about is how patients benefit. Well, the way a patient would benefit is, again, we're getting to the root of the issue with the patient. And so ultimately, we're putting them on a therapy that doesn't cause them to need that therapy for the rest of their life if they do it once or twice a month or something like that. Generally, we want to get them in anywhere between 12 and 20 sessions. And in that time frame, they should gain their independence back by correcting a specific issue. So this is a semi-permanent solution. It's a semi-permanent resolution to their pain. I say semi because who can guarantee everything 100% of the time? It's not going to work. But I have over a 95% success rate with these patients, and they walk out feeling incredible. People that are on walkers, that have started on walkers, and after session 15, they're actually walking without the walkers and retraining their brain what to do with their body. That's the important part. And the way we do that is with repetition. Unfortunately, if we leave that to ourselves and no external device, which is a device that I use to reprogram these things, it takes very, very long. It takes months, maybe even years, and nobody has the stamina to remember consciously how to do a specific movement every time they do that movement for 6 months to 3 years. Like, it's impossible. And so with the therapy device that I use, it kind of looks and feels like a NeuroStim, but it's not like a TENS unit or anything. It's actually a very smart machine. It's reprogramming the brain 500 times a second to eccentrically contract, where it doesn't literally eccentrically contract the muscles. You, as the patient, have to tell the body what to do when pads are applied to that area in order to teach that muscle what to do 500 times a second. So say I pad somebody up, I have them sit down and stand up. Well, their brain physiologically doesn't know the difference between doing that once and 500 times. So the learning curve is exponentially increased, and they can get out of their bad posture and their bad habits almost instantly. It's great. So that's how the patient can benefit. They're looking at resolving their pain, not just managing it, not just masking it. It's really important that we get down to the root of things, and that's what I provide. How you benefit as a practitioner. You're adding a new treatment into your therapy. You're adding a new option or opportunity for the patient to decide, do I really want to jump right into meds or right into surgeries? If that's something that you do frequently in your clinic, then this may not be the right fit for you. But for those that are looking for an alternative to get their patients off of meds and to get them potentially off of a surgery table, this is a great option. And I have helped a number of patients do this, whether it's with carpal tunnel or sciatica or doctors wanting to fuse discs or put in titanium rods or things like that, when realistically all it is we got to tell that muscle pretty vigorously how to let go and stop the splinting response that is causing this damage in the body, which you don't want, because if it stays in that state where muscles are like this instead of like this, and you can't consciously make the effort to release that muscle on your own, well, it's going to stay like that, and it's going to compress and cause inflammation, and it's going to cause the cascading effect of the stress responses and the body thinking that it needs to repair whatever's going on here that is not letting go. That's what we do with the neurotherapy. Instantly, we can let these muscles go, get them to perform their jobs once again, so that way it maintains the integrity of the joints and the tissues and the bones and everything around it, not to cause additional harm and additional stress and issues. So this is how everybody can benefit from this therapy. If you are looking for an alternative to your therapy to add to your practice, where it's non-invasive, it doesn't rely on the advocation of surgery or painful or harmful medications that can essentially cause somebody to be dependent on it, and you want your patients to gain more independence, this definitely seems like it would be a good treatment option for you. Please like me, follow me, whatever it is. I have no idea where I'm going to be posting this yet, so whatever that means, feel free to contact me either through Facebook. I'll go ahead and put my information in the link below and everything. My number is 480-202-0456. Or you can visit my website at neilphoenixneurotherapy.com. And again, I'll have all that information ready for you guys to take a look at. I really look forward to hearing from you soon, and I hope this video helped. Please get in touch with me if you have any questions, and be well.